Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with us.
Wow, ladies and gentlemen, once again, good day to the online pregnancy school. How are you doing? I trust you are doing very well, and we still thank God for the gift of life and an opportunity to serve mankind. This is the online pregnancy school, and today I'm going to share with you another important topic. I always say it's important because it is, truly, and we are thankful to God that it is making impact. From the questions we have received, from the feedback, and by God's grace, some of the people who have been joining us have delivered, and we say we are grateful to God for safe delivery. Our prayer is that a lot more people will become pregnant as they desire to be, and also go through pregnancy successfully and have healthy outcomes. That means that the babies will be healthy and the mothers will also be healthy. If today is the first day you are joining us, then you are most welcome. For those who have been joining us, you're also most welcome. And I want you to continue sharing this with friends and family, because you never know, you may be answering somebody's question. So please go ahead and share with friends and family and invite them to join us, even as the program is going on. And I want to remind you of the magazine, Promise from the Womb. I always say that from some of the questions that we receive, I get convinced that every pregnant woman or anyone who is desiring to become pregnant should have a copy of that book. And if you are in Ghana, because we are in Ghana, if you are in Ghana and you'd like to have a copy, maybe you are not in the Accra area, but just send me a WhatsApp message on +2335924200625, and we'll find a way to get the magazine to you. If you have joined us for the first time, my name is Dr. Linda Vanutu, and it is always a pleasure coming your way with the online pregnancy school, because as I say, pregnancy should be a time of joy and not of fear or anxiety. And if that will happen, it means that you have to know more about pregnancy and what you should expect, so that when anything goes wrong, you would know immediately and report to the nearest hospital. So please, for husbands, try very hard to show interest in your wives when they are pregnant. Look at the antenatal card. It's a very important document because it will have records of what is happening to the mother and also to the baby, as well as what you should expect going forward. So please, if you're a husband who hasn't been checking the antenatal card of your wife after she's visited the clinic and come back home, please do that so that you apprise yourself of what is going on, and then you can support the pregnant woman, because pregnancy can be challenging for a lot of people. Well, today, what am I going to talk about? Another important topic. So let's see what we have here. Yes, I'm going to talk about blood groups and pregnancy. This is very important. I'm sure for some of you, you have gone to the hospital and you've been told that you need to get someone to donate blood to keep, so that when the time comes and you need the blood, it can be given to you. In some instances, people do not have to do that because blood is always available. And that means that there should be somebody or some people out there who decide to donate blood for pregnancy, so that people who are pregnant would have blood available if they need to be transfused. Ladies and gentlemen, let me take this opportunity to encourage people who feel strong within to help by going to the nearest hospital and asking how you can donate blood, because it is important. We all know the importance of blood. And in our previous session, we discussed bleeding during pregnancy. And it's a very, very, very important cause of not a poor pregnancy outcome. It could be that the mother loses her life, the baby loses their life, or even both of them can lose their lives. So it is very important. It's one of the critical things that can happen in pregnancy that we want to avert. And if a woman loses so much blood, there's a need for her to have that replaced. So please, let's use this as an opportunity to help to donate blood to the hospitals. So today I'm going to talk about blood. And this is based on a question that I received from one of our distinguished listeners and viewers. And the question is, dear doctor, I will be very grateful if you could kindly explain blood groups to me. My wife is pregnant and has been attending antenatal clinic. I realized that her blood group was checked during her initial visit and recorded as O negative. I am blood group AB positive. And this gentleman would like to know more about blood groups and how they can affect pregnancy outcomes. And he's asking the advice that we can give to him and the wife. So you see that this person took interest and saw that the wife's blood group had been checked. So please, as I said earlier, gentlemen, if you have your wife going to the hospital and coming back, please check what was said. So I'm going to use this question as the basis to explain some things about blood group. So people know, some people say I'm O positive or O negative, I'm A or B. So what is it? Now, a blood type is also known as the blood group. So if you go and have your blood type checked, it's the same as having your blood group checked. And it's a classification of you, the individual's blood. So it is you. And whether it is A or B or whatever is based on the presence and or absence of antibodies and inherited antigenic substances. Don't try to understand it, just get it that there are substances in the blood that will determine your blood type. And these can be found on the surface of the red blood cell, what is called the RBC. So this is what will tell you whether you are this type or that type. And these antigens that are found may be proteins or carbohydrates or the others that we have mentioned. And please take it that blood types are inherited and represent contribution from both parents, just like other things that we receive from both parents. This is it. And the two most important that we work with are the ABO and the Restless. And these determine the person's blood type or blood group. So it can be A, B, AB, O, and you see that they write either positive or negative. And this is very, very important. If you go to the hospital, your blood group is checked. This is important because then they will know how to treat you if you need blood going forward. Blood transfusion is a whole thing altogether. It is very, very, very important. But today I'm going to talk about blood group and pregnancy. So having known that we have A, B, and O, what is the Restless factor, the positive and negative? It is an antigen that is found on the red blood cell of most people, and it is inherited from our parents. So when you go to the hospital, they do a simple blood test, and that will determine your blood type with the Restless factor. So they will not write just A or B or A, B or O. They will put either positive or negative to show you your blood type. Now, if the Restless factor is present, then that person is Restless positive. And if it is absent, then the person is said to be Restless negative. So this Restless factor, which is an antigen found on the red blood cell, if it is there, then you are positive. If it is not there, then they say that you are Restless negative. I hope you are getting that. Today we are doing a little bit of teaching, but it's important to understand this, especially because you might have gone to the hospital for medical screening or anything, and they check your blood group. And it's important that you understand what it is and how it is used. So I'll do a little bit of that before I talk about the importance in pregnancy. Now, this is what it is, just all that I said. So if you are blood group A, like we see here, then these things are round. They are the antigens. So the antigen in the red blood cell is the A antigen. If you are B, then it is the B antigen. If you are AB, it is the A and B together. And if you are O, then you don't have the antigen. Now, also of importance is the antibodies in the plasma. So the antibodies here means that this, if you are A, you have anti-B. If you are B, you have anti-A. If you are AB, you don't have. And then if you are O, you have anti-A and anti-B. This is very, very important because it helps with blood transfusion. What type of blood to give you depending on your blood group. But this one is the health workers thing. You don't really have to memorize it or anything, but just to let you understand what it is. Now, for the father who asked that he is AB and the wife is O negative, this is how it looks like. I told you that the child inherits from both parents. So up here, you find the father's blood type, either AB or O. And then here we have the mother. The mother can be A, B, AB or O. And then the child's blood is the yellow portion that you see here. So let me give you an example. For this father who was AB and the mother is O, this is what the child would have. The child would either be A or B. So this one helps to determine what the probability is. Or if you know the child's blood type, then we can use this to determine the mother and the father's blood type. So this one is also good for the hospital to use because then they appreciate what it looks like. But this person who asked the question is concerned about the wife being O negative, and we'll come to that soon. Ladies and gentlemen, if you haven't done that, please go ahead and hit that subscribe button. Also turn on the notification bell. And on Facebook, follow me, The Pregnancy School. So I told you that it is important to know the blood type because if it becomes necessary to have blood transfusion, then they know which blood to give. Because if the wrong blood is given, it will be detrimental to the life of the person receiving the blood. So it's very, very important. And again, you don't have to memorize this because you wouldn't need to know what it is, but just for you to appreciate that blood types are very important because they tell you who you can donate blood to or who you can receive blood from. And the hospitals use this to help us do our work very well. So if you just take a look at this, and I'll just go through a few, you see that if you are O positive, and a lot of people say they are O positive, it means that they can give blood to these people, and they can also receive blood from people who are O positive or O negative. If you are O negative, then you can give blood to everyone, and you can receive blood from O negative. So depending on the blood type that you have, the hospitals will determine which type of blood you can give to somebody and which type you can receive. Now, the other important thing is that sometimes we have people going to donate blood for their relatives. They get there and they are ready and willing to do it, but their blood type is such that they cannot give the blood to their relative. So if the hospital has the blood in store donated by a donor, somebody, but not for any specific person, then what can happen is that they can take this blood and give the patient the blood that the patient needs and keep this one for somebody who would come in the future. So it is very important that we always have blood available in the blood bank to help people to survive. People who unfortunately get injured in an accident, or anybody who for one reason or the other needs to get blood. And even for some people, because of some sicknesses that they have, they need to be given blood. So it's important that we try and donate blood. Ladies and gentlemen, if you have just joined us today, I'm talking about blood groups and pregnancy. And this is based on a question that a gentleman sent to us, that the wife is O negative and he is AB, and wanted to understand a little more about blood type. Now, This is the explanation for what I just showed you. Who can give blood to which type? So if we take one or two as examples, you find that for blood group AB individuals, they have both the A and B antigens on the surface of their red blood cells, as I showed you earlier. Now, the blood plasma does not contain any antibodies against either A or B. If it does, then it will be fighting against that. So individuals with type AB can receive blood from any group, with AB being preferable. So when you go to the hospital, they will check, but they cannot donate blood to any other group than the AB because of the nature of their blood. And so they are universal recipients. It goes on. So you take blood transfusion for somebody who is A, then they have A antigen, and the blood serum contains antibodies against the B antigen. So A group individuals can receive blood only from individuals of group A or O, with A being preferable. But if you go to the hospital, you are A, and they don't have the A, they can give you the O, and they can donate blood to individuals who are type A or AB. And then it goes on. So the B also have the B antigen, and they contain antibodies against the A. So they have, if they need to receive blood, then they can receive blood from B or O, with B being preferable. And they can donate blood to B or AB, like we saw for the A. But if you are O, then you don't have A or B antigen, and the serum contains antibodies against the A and B, so you can receive blood from only group O individuals, and you can donate blood to anybody, ABO group. But when it becomes necessary for urgent transfusion, then, and when time is of essence, then O negative blood can be issued because it is compatible with anyone. We said that if you are AB, it's good to have blood from AB, but in the absence of that, then if O negative is available, then that can be given because you can give to anybody. And this lady we are talking about is O negative. Now, what is the importance of all this in pregnancy? If a Restless negative woman becomes pregnant and the husband is Restless positive, then that baby can end up with Restless positive like the father. That can happen because we don't want to go into so much detail, but just understand that this can happen. And if some of this baby's blood unfortunately passes into the mother's blood during delivery or procedure, or even the mother is transfused, and we have some form of this blood getting in, then the mother can develop antibodies against that blood. And this, if it happens that this baby is positive, the mother is negative, and there's a mixture of the blood, the mother can develop antibodies against that positive blood that has come. And this can lead to what we call Restless disease in the newborn. And today I'm not talking about that one. We can have time to talk about it into detail in the future. But this is the real reason why it is important to understand. Now, if a pregnant woman is known to have the anti-D antibodies, then the blood type of that fetus can be tested by analysis. In some parts of the world, you find that if the mother is known to be negative, then while she's still pregnant, they will try to check the type of blood that this child has to assess the child's risk of developing this Restless disease. And I told you that today we are not talking about the Restless disease. We can talk about it in the future, but the importance of the question that we have is this, that it's important to know what type the child is and whether this mother has had any positive blood coming into her, either from previous pregnancy or from a procedure or from transfusion. But that is important. And why is this important? Ladies and gentlemen, this is the online pregnancy school. And today I'm talking about blood group and pregnancy. And it is based on a question where a woman is O negative and the husband is AB positive, and he wants to understand what can be done. Now, because of the effect that this rhesus negative and positive can have, where the mother is rhesus negative, a lot of interventions are available, gladly, so that these women do not suffer. So in a rhesus negative woman, where the blood group is tested for this child, I've said that this can happen during pregnancy. It is assessed. Then that will help to intervene so that this woman can have a normal baby and have future pregnancies as well. And what is done is that they give this woman an injection. This injection is called immune globulin to prevent the formation of the anti-D antibodies, which can affect her babies. So this woman who is O negative, when she gets to the hospital and she's found out to be O negative, and they don't even know whether this baby is going to be positive or not, because they don't know the father, whether the father is positive or not, then in some instances, this is done so that if it is that the child is positive, then this woman is protected before the child is born. And this injection can be given, of course, after prescription by the doctor, between 28 to 30 weeks gestation, but when the pregnancy has gone to that level, and also after delivery within 3 days. So you find that there are some women who have gone to the hospital and they've been told that they are O negative, therefore they should prepare for this injection. Maybe they haven't understood it, because some people are not sure, why should I be given this injection? But from what I've said so far about what is on the blood cell, the red blood cell, the antigen, and the mother's antibodies, and the mother being negative, if she carries a baby that is positive and there's a chance of mixture, if the baby's blood gets mixed up with the mother's blood, then the mother can develop antibodies or soldiers to fight that blood that has come, because she will see it as something that is foreign or something that is an enemy, so to speak. And that means that it would affect the outcome of pregnancies. So this is done. So if the mother is found to be negative, then this particular treatment is given whilst the mother is still pregnant, and also if the mother delivers within 72 hours. But if it turns out that the baby is negative, then of course that injection after the delivery would not be needed. So in the case where it is not known the blood type of the baby, while the baby is still inside the mother's womb and it is found that the mother is O negative, then they can give this injection. And also after delivery, if that child is positive, rhesus positive, then another injection is given. But if the child turns out to be negative, then it will not be necessary to give that injection. I hope you understand. You will understand more. So, ladies and gentlemen, today I wanted to address the question that our friends sent to us by letting us know that if you are a pregnant woman or if you are a lady, know your blood group. Know your blood group because it is necessary so that you protect your child, your future pregnancies. Now, when you go to the hospital and you are O negative, even if your husband is O positive or AB or whatever positive, please understand that you can still have a good pregnancy with good outcome once it is known and the intervention is given. And treatment is available, as I just showed you. You can be given an injection and that will protect you. Now, the thing is that you have to give a good history when you go to the hospital and you are pregnant. Irrespective of the outcome of a previous pregnancy, you have to let the hospital know that I have been pregnant before. Even if you terminated the pregnancy yourself, you have to let them be aware, because if you do not do that and you are negative and you have maybe in the past, you became pregnant, you terminated it, and the child was positive, and this child's blood got mixed up with yours. It means that you, the mother, you have now developed soldiers to fight that kind of blood, the positive blood that came to you. So if you go to the hospital and you have been pregnant before, it is very, very, very important that you let them know, irrespective of the outcome of that pregnancy, especially with this case that we are talking about, if you are O negative, because if it happens that the baby that you carried earlier was positive, it means if there's a mixture of your blood and that baby's blood, your body has developed soldiers against that type of blood. So if now you become pregnant and that baby is also positive, your body will see that this is a foreign person. This is not allowed here. So the body, your body will now fight against that baby. And this can happen, and a lot can happen to the baby, including even death. So it is very important that when you go to the hospital, you give a good past history of your pregnancy. And whether you have had blood transfusion before, you have to let them be aware. And also, if you have ever had the treatment with anti-G, you have to let them know. So the take home is that know your blood group, give a good history if you go to the hospital of your past pregnancies and histories. If you have also been pregnant before, but you have lost the baby, maybe the baby was born, unfortunately dead, or the baby came out and died soon, whatever the outcome of a previous pregnancy, please, when you go to the hospital, let them be aware, because it will be very helpful. If they know that this is what happened, then they will go further and find out why that happened, that you lost your babies. And then if it is necessary to give you any treatment, they will do that, or whatever counsel there is for you will be given to you. So please remember, even if you have had a termination before, let them be aware that this is what had happened earlier. And it's also important that you cooperate with the hospital or the care provider, because it's not everything that may be covered wherever you are by the insurance. So if it is found that you have to buy this medication, I don't know where you'll be listening to from, but if it is found out that the hospital does not have insurance cover for this particular medication or any other thing that is needed for you, please prepare for it, because your blood group will be checked early. So if there's anything to be said, you can discuss it and you plan and prepare for that one. That will be very, very, very helpful, because even if this first pregnancy is not affected, in the future pregnancies may be affected and the outcome will not be good. Ladies and gentlemen, today I shared with you some tips about blood group. It's a very big topic. There are so many things to be said, but I wanted to make it as simple as possible for you to understand that we have different types of blood group, and depends on you as an individual. You can be A, B, AB, or O, and each of them could be positive or negative. But today, we wanted to address the issue of a woman who is O negative and is pregnant. And the idea is that it is possible to have a normal baby, but you should cooperate with the hospital if you have ever been pregnant before, irrespective of the outcome, or if you have had treatment for that before, or even if you know it yourself that I am O negative, and when I was pregnant with the first, they gave me this medication. It is good. So that can happen. I hope that the gentleman who asked us the question will find this useful, and also other people. So please, once again, gentlemen, when your wives come back from the antenatal, take a look at the antenatal card and help them to go through pregnancy, because it can be really stressful. Well, I hope you have enjoyed today's session, and looking forward to coming your way again with another very important topic. Please share your comments and your any suggestions that you have. And if there are specific questions that you want us to answer, please send me the message in the comment section. On YouTube, The Pregnancy School with Dr. Linda Vanuatu, and on Facebook, the Pregnancy School. Or you can send me a WhatsApp message. Please, WhatsApp message. Please, WhatsApp message. +233 59 242 0625. And don't forget the magazine, Promise from the Womb. It is a must. It is a must that you must have. I'll see you in my next video. Enjoy the rest of the day. And remember to continue to keep safe. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online Pregnancy School as she discusses pregnancy, delivery, and childcare with experts.